Okay, the next item on the agenda is a regulatory document, REGDOC-2.10.1, Nuclear Emergency Preparedness and Response, is outlined in CMD 14M53 and 14M53.A. Before turning to the CNSC, I understand we have people from the Office of the Fire Marshal and Emergency Management Ontario available for question. And I understand they are online. So is it Mr. Contra? It's online?
Good morning, Dr. Bender. It's Mr. Contra here, and we're just inviting Mr. Waslavic to join us for this particular item.
Okay, thank you. Anybody else online? Please ask. Anybody else online? Okay, so let's turn the floor to, I understand Mr. Awad will make the presentation. Please proceed.
Thank you very much, Monsieur le Président. Membres de la Commission, bonjour. My name is Raoul Awad, Director General of Directorate Security and Safeguard. With me today, Mr. Jerry Frappier, the Director General of Assessment and Analysis, Mr. Brian Torrey, Director General of Regulatory Document Directorate, Mr. Luc Sigouin, Director of Emergency Program Division, and Mr. Alex Victorov, the Director of Reactor Behavior. We are here today to request the REGDOC-2.10.1 Nuclear Emergency Preparedness and Response to be approved for publication and use by CNSC staff in assessing the acceptability of Emergency Preparedness and Response program. As Mr. Frappier mentioned, it's where this document is situated. It's under the Emergency Management and Fire Protection framework. And we'll start with an overview and provide contextual information, explains the consultation process and the outcome, and finally, we will give our recommendation. An effective emergency preparedness and response program is critical to protect workers, the public, and the environment in a highly unlikely event of nuclear emergency. This REGDOC will assist Class 1 nuclear facility and uranium mines and mills licensees to develop, implement, and validate an effective emergency preparedness program by providing requirement and guidance. The document was developed through extensive consultation process with licensees and other stakeholders. We go back to the same figure that you like it, Dr. Bender. The emergency management include the prevention, mitigation, preparedness, response, and recovery of nuclear emergency. The prevention of nuclear emergency is the responsibility of the licensee, and the CNSC regulate nuclear facility to ensure that adequate provision are in place to prevent accident emergency. The CNSC further regulate to ensure that in event of an accident or emergency in the facility, mitigation equipment, procedures, and protocol are in place to reduce potential magnitude or impact of an event. As Mr. Frappier mentioned, this diagram will provide an overview of the key emergency management component and how they are addressed through the both regulatory document 232 and 2.10.1. And again, the same slide that we saw this morning. This is to explain the relationship between both documents and how they complement and support each other and interact with each other. For the current statute, to be clear, the development of 2.10.1 was not initiated due to the CNSC concern over existing emergency management program at Canadian Nuclear Facility. Previous to March 2011, licensee had robust programs in place, and in response to Fukushima accident, licensee further strengthened their program. In addition, in June this year, CSA standard N1600, which is entitled General Requirement of Nuclear Emergency Program, was published. The standard will strengthen emergency program through establishing criteria for the emergency management program of on-site and off-site organizations. While there has been a positive development, there is opportunity to strengthen and standardize emergency response in Canada through 2.10.1. Go back to Fukushima accident. The CNSC launched review of all major nuclear facilities in Canada through the creation of the CNSC Fukushima Task Force. The task force concluded, however, that there is opportunity to improve the emergency preparedness and response effectiveness, including within the CNSC regulatory framework. While licensee meet emergency preparedness and response expectation, the Fukushima task force noted that there was no regulatory requirement or standard that ensure consistency among licensees. The example of the multi-unit emergency and blackout condition were not adequately addressed in existing framework. In addition, the document will address the need for pre-distribution of iodine thyroid blocking or KI tablets and improving information sharing. The last 2 points will be discussed in detail in the next few minutes. The document provides a clear high-level requirement and supporting guidance to assist licensee in developing, implementing, and validating emergency program. The document set general requirement applicable to all licensee and additional requirement for reactor facility with thermal capacity greater than 10 megawatt thermal. This 10 megawatt thermal threshold aligns emergency preparedness requirement with the potential risk posed by the facility. The threshold is in line with IAEA guidance for emergency planning. For reactor facility below 10 megawatt thermal, the IAEA Safety Guide GS-G2.1 concerning nuclear or radiological emergency suggests a primary emergency planning zone of 500 meters or half-kilometer radius, which is the minimum distance listed. Due to the lack of potential consequences, the IAEA notes that there is no need to establish larger emergency planning zone for such kind of reactor. In providing the requirement and guidance that licensee and applicant for license need to implement and consider in the design of their emergency preparedness program, REGDOC-2.10.1 explains 4 fundamental components: planning basis, response plan and procedures, preparedness, and program management. The REGDOC introduced enhanced provision of off-site activity at applicable facility, including requirement for pre-distributing of iodine thyroid blocking agents and providing additional emergency preparedness information. This represents a step forward in protecting health and safety of individuals living and working within the immediate vicinity of large nuclear power plant should nuclear emergency occur. Approaches to pre-distribution of iodine thyroid blocking agents vary both domestically and internationally. Some countries like France, Czech Republic, Finland, Sweden, and Switzerland require pre-distribution. Others, such UK and Hungary, stockpile the KI pills at certain locations to be distributed by emergency services at designated location only at the time of emergency. In the United States, the NRC requires consideration of the potassium iodine as a protective measure for general public, but the decision to pre-distribute is left to the individual states. In Canada, there is currently no standard for pre-distribution of iodine thyroid blocking agents. KI pills are distributed to all residents within 20-kilometer emergency planning zone around Pointe-le-Preau. In New Brunswick and in Quebec, KI pills are pre-distributed to all residents within 8-kilometer emergency planning zone around Gentilly. The REGDOC-2.10.1 contains strengthened provision requiring the distribution of public information related to emergency preparedness and providing emergency planning information to regional and provincial off-site authority. At recent commission hearing, issues related to distribution of emergency management information to the public and ensuring that multi-jurisdictional emergency response plan are effectively integrated were discussed. The REGDOC address each of these issues and include requirements associated with these issues and other guidance. As I mentioned at the beginning, the REGDOC has gone through extensive round of public consultation. A draft version of 2.10.1 was provided to stakeholders for consultation from August 20 to October 19, 2013. During the consultation period, the CNSC received 125 comments from 11 reviewers. 8 reviewers were from industry and an additional 2 from government, which is Environment Canada and the Office of Fire Marshal and Emergency Management, as well as environmental, non-governmental organization like Canadian Environmental Law Association, the CELA. No additional comments were provided during the comment on the comment period. Following the initial consultation period, some additional requirements and guidance were added to the document due to the development of the which followed the initial drafting consultation version. The pre-publication of final draft of CSA standard N1600 acknowledged the role of iodine thyroid blocking agents in emergency response, but remained silent on requirement for their pre-distribution. As a result, CNSC staff felt it's important to provide clarity on issue through the REGDOC 2.10.1. In addition, stakeholders' feedback on consultation draft and discussions at recent commission proceeding indicate the need for additional requirement. Due to this additional requirement, CNSC conducted additional consultation activity to engage stakeholders on these new provisions. Stakeholders who commented on consultation draft of the REGDOC were informed of the additional requirement via email on April 10, 2014. This resulted in 28 comments from 7 reviewers. The reviewers included 4 from industry, the Ontario Office of Fire Marshal, and CELA and Greenpeace. The consultation report summarized the key comments received during the consultation period and provides the CNSC response. The next few slides will highlight the key stakeholder comment. The first key comment regarding document scope. REGDOC 2.10.1 had requirement applicable to all licensees with additional requirement for reactor facility with thermal capacity greater than 10 megawatt thermal. Stakeholder comments, uranium mine and mills, and the Class 1B facility noted that the document scope was unclear. CNSC did not alter the scope of the document, but clarified the distinction between universal requirement and those applying only to applicable reactor facility with a capacity of 10 megawatt thermal and greater. The second key comment regarding venting notification, stakeholder mentioned that the draft document stated that the CNSC had to be notified ahead of any venting action, and the circumstances may require immediate venting to maintain containment integrity that would preclude notifying before taking action. CNSC acknowledged the concern and modified the text to add a caveat stating that if prior notification of venting could not be made due to exigent circumstances, notification was to be made as soon as possible after venting. Other key comment related to additional requirement, as I mentioned a few slides ago, the CNSC conducted additional consultation on a new requirement of this REGDOC, which were not in the initial consultation draft. The new requirement added after the first consultation are related to the KI pills redistribution, the distribution of emergency preparedness information to the public, and ensuring that multi-jurisdictional emergency response plans are effectively integrated. Stakeholder comment on the new requirement necessitated additional consultation. Stakeholder requested a meeting for further discussion and clarification related to the additional requirement. In June 23rd, meeting was held to discuss how stakeholder comment on the additional requirement were treated and dispositioned. It also provides opportunity to answer any residual stakeholder question or further qualification in advance to the Commission consideration of the document. The meeting was well attended with 21 representatives, including 10 from the industry, 5 from non-governmental organizations, 4 from Health Canada, and 1 from the general public, 1 from the Office of Fire Marshal and Emergency Management. Concurrent with the meeting, OPG, on behalf of industry, submitted additional comment on the post-consultation draft of the document that was sent to all who commented on the initial draft. The result of the meeting are included as a part of the disposition table. The final key comment was related to the iodine thyroid blocking agent redistribution, including comment provided on June 23rd meeting. These comments were, first, jurisdictional issue have to be sorted and recognition provided on key roles and responsibility of site organization. 2, pre-distribution of ITBs or KI pills has to be an accompanying, has to be with information, or has to be accompanied with information program. If it's to be effective, communication, education are critical to the success. Geographical and legislative differences have to be considered when developing a pre-distribution plan. Most effective mean of pre-distribution is not established. And as we discussed earlier, the international and domestic experience showed that pre-distribution of iodine thyroid blocking agents are safe and feasible to implement. It's necessary to represent a key mitigation measure in the event of nuclear emergency. The version of REGDOC-2.10.1 before you address the concern raised on the meeting of June 23rd and its supplemental industry comment. The CNSC modified the text to address the role played by the provincial authority, and the guidance section was updated to note the importance of associated public information program. Licensee provided the latitude to develop the most effective means to distribute the KI pills to suit local circumstances. For the implementation, the Fukushima Task Force recommended that existing CNSC Emergency Preparedness Guidance Document G225, Emergency Planning Class 1, Nuclear Facility and Uranium Mine and Mills, published in 2001, and the RD 353, Testing and Implementation of Emergency Measure, published in 2008, be strengthened through the creation of consolidated REGDOC for emergency preparedness. And this document, if approved, will replace these two previous documents and will be published on the CNSC website and made available to the licensee and stakeholders. This document, if approved, it will be applied to existing Class 1A, 1B, and uranium mine and mines facility, as well as future such nuclear facilities. It will be included as appropriate in the license or license condition handbook as either part of the condition and safety and control measure or as a part of the safety and control measure to be described in the license application and the document needed to support the application. Reactor facility operating license will be amended at the stage of the relicensing. The use of graded approach commensurate with the risk when applying this requirement. It's expected that should REGDOC 2.10.1 be approved, the pre-distribution of KI pills or iodine thyroid blocking agent within the applicable primary zone would be completed by December 2015. In conclusion, as the REGDOC was developed through extensive research and broad-based consultation with stakeholders, CNSC staff affirmed that the proposed document will strengthen and modernize the emergency preparedness and response framework, balance the relative risk posed by the various facilities with the action required, and improve public preparedness through the pre-distribution of KI pills and provisions related to emergency planning information. And as I mentioned, this document went through extensive consultation process, and it's ready for final approval by the Commission and for the use by CNSC and the licensees. Based on this conclusion, CNSC staff believe that the REGDOC Nuclear Emergency Preparedness and Response is ready for final approval and publication and used by CNSC staff in assessing the acceptability of licensee emergency preparedness program. Thank you for your attention, and we remain available for questions.
Thank you.